My name is Allie. I'm going to be the student nurse working with you today. It's nice to meet
Nice
you.
to meet you.
Can you confirm for me your name and date of birth?
Nicholas Josh, 9/16/96.
Okay, wonderful. Everything matches. I'm going to go ahead and wash my hands, and I'm going to pull the curtain to give us some privacy so we can get started.
Okay.
All right. Can you tell me what brings you in today?
Here for my annual physical.
Okay, wonderful. Let me just check the doctor's orders and make sure that matches with what we have. And yep, we are good to go. All right, perfect. Can you tell me, are you in any pain right now?
I am not.
Okay. And do you have any allergies I should be aware of?
No.
Okay, great. Can you tell me where you are right now?
Yeah, Ottawa Health Center.
Okay, great. And can you tell me today's date?
March 10th of 2021.
Okay, wonderful. So based on the fact that you could tell me your name, where you are, today's date, and the situation, it is safe for me to conclude that you alert and oriented ×4, which is good. Based on appearance, I can tell that you're well groomed, your hygiene is appropriate and adequate, your facial expression is relaxed, your posture is erect, your movements appear to be intentional, and your thought process is logical, which is all normal findings.
Okay.
Okay, great. So what we're going to do today, Nick, is we're going to do a head-to-toe assessment, which is basically just kind of a general overview of you and your health so we can check for any abnormalities.
Okay.
Does that sound good?
Yeah.
Okay, great. So we're going to pretty much start at your head and kind of work my way down, if that's okay with you.
Yeah.
Great. Do you have any concerns with your head that I should be aware of? Any pain?
No.
No? Okay, great. So from appearance, I can tell that your head is normocephalic. It is round, it is symmetrical, and I do not see any lesions or masses present. Do you mind if I palpate your skull?
No.
Okay, just let me know if you have any pain here. Any pain?
No.
No? Okay, great. Okay, so we're gonna move on, and I am going to assess your eyes.
Okay.
You have any concerns with your eyes that you wanna let me know about?
No.
No? Okay, wonderful. Then I am going to dim the lights in here, and I'm gonna check your pupillary reaction, okay?
Okay.
All right. Okay, so I could see that there was accommodation bilaterally, which is a normal finding. Once again, I'm going to ask you to look straight forward and just follow my pen light.
Okay.
Okay, and I could see convergence bilaterally, which is normal finding. And then one more time, I'm going to ask you to follow my pen light.
Okay.
Okay, you were able to track movement in all 6 cardinal gazes, which is a normal finding. It indicates that your cranial nerves are working well. And from visual examination of your eyes, I can see that your sclera is white. Your pupils are blue-green in color. Your pupils appear to be active. They are reacting to light normally, and they are equal in size, about 4 millimeters in diameter.
Okay.
And the conjunctiva is clear of signs of infection. All right, I am going to move on and assess your mouth, if that's okay with you. So I'm just gonna have you go ahead and open your mouth for me. Okay, can you stick your tongue out for me? Good, and can you say ah? Wonderful. So what I can see is that the mucosa is pink and moist. The teeth are intact. I do not see any lesions. Your uvula rises with phonation, which is good. And your tonsils were visible and were graded as a 1+.
Okay.
Okay. And your ability to stick out your tongue and say ah indicates that your cranial nerves are working properly. Can you just say light, tight, dynamite?
Light, tight, dynamite.
Great. And that indicates that your cranial nerve 12 is working properly.
Okay.
All right. Can you go ahead and turn your head to the side for me? All right. Wonderful. And then the other side. Okay. So your ears appear to be symmetrical on your head. They are normal in color. Do you mind if I palpate?
No.
Okay. They're normal in temperature. And I do not see any drainage or foreign bodies present, which is good. Do you mind if I palpate your ears?
No.
Okay, can you turn your head again for me? All right, so I'm just gonna push on your tragus, pull on your pinna, and press on your mastoid process. Any pain there?
No.
No? Okay, good. I'm gonna do the same thing on the other side. Push on the tragus, pull on the pinna, and press on your mastoid process. Any pain in any of those spots?
Nope.
No? Okay. And then I'm just gonna put my hands here and I'm gonna ask you to open and close your jaw for me. Good. Any pain with that movement?
No.
Okay. There was no crepitus noted and the joint movement was fluid, which is good. So at this point, I'm gonna move on to assessing your nose. Can you kind of tilt your head back for me? Okay, wonderful. And then can you press one finger against your nostril and sniff in? Good, and same thing on the other side. Good. So your nares are patent bilaterally, which is good. I can see from visual inspection that the color of your nose is normal, your skin is intact, and there's no deviations present, all of which are normal findings. So I'm gonna go ahead and move on to assessing your lymph nodes. Do you have any pain or tenderness anywhere in your neck that you're aware of?
No.
No? Okay. So I'm gonna palpate 10 different groups of lymph nodes. With any of those spots, if there's tenderness, please let me know.
Okay.
Okay. So we have your pre-auricular lymph nodes, your post-auricular lymph nodes, your tonsillar lymph nodes, your occipital lymph nodes, your posterior cervical lymph nodes, your superficial cervical lymph nodes, your posterior cervical lymph nodes, your submandibular lymph nodes, your submental lymph nodes, and your supraclavicular lymph nodes. I did not know any swelling at any of those points, but did you have any pain or tenderness?
No.
No? Okay, good. That is good. Can you sit up for me a little bit? I'm just gonna assess your thyroid gland. From appearance, it appears to be symmetrical and I do not see any lesions or masses. Do you mind if I palpate?
No.
Okay. Good. All right, so your thyroid gland appears to be symmetrical. I did not feel any lesions or masses, which is good. And I am going to do something called the whisper test with you.
Okay.
So I'm gonna have you turn your head one direction and I'm gonna whisper 3 words in your ear. I just want you to repeat them for me.
Okay.
And we'll do the same thing on the other side.
Okay.
Okay.
Today is Monday.
Good.
Tomorrow is Tuesday.
Okay, wonderful. So from that, we can tell that your cranial nerves are working properly, which is good. And then we are going to move on to assessing your chest area.
Okay.
Do you have any concerns with your breathing, your respiratory system?
No.
No? No cough?
Nope.
No? Any chest pain, heart palpitations?
Nope.
No? Are you a smoker?
No.
Do you have a history of smoking at all?
No.
No? Okay, wonderful. Okay, so what I'm gonna do is I am going to place my hands at several specific points on your chest and I'm gonna do what's called percussion. So I'm gonna kind of go like this,
Okay.
just to feel if there are any abnormalities present, okay?
Okay.
All right. I did not feel any abnormalities with percussion, so the next thing I'm going to do is auscultation. So I'm going to place my stethoscope at those same points that I was just at. And every time I do that, I want you to just take a nice deep breath for me.
Okay.
Okay, thank you. lungs were clear to auscultation in all fields, and there were no crackles, wheezes, or rhonchi noted in any of those locations, which is a normal finding. Can you actually turn around and face the other direction for me? I'm going to assess your posterior lung field. So I'm going to do the same thing that I just did. I'm going to percuss, followed by auscultation. Okay, there was no abnormalities noted, so I'm going to move on to auscultation.
Yes.
So every time I place my stethoscope, I need you to take a nice deep breath.
Got it.
Okay, good. The lungs were clear to auscultation in all fields, and there were no wheezes, crackles, or rhonchi present, which is all good. So the next thing I want to do is I want to just have you take a nice deep breath for me. Okay, good. So my hands were moving symmetrically when you did that, which indicates that both of your lungs are working equally, which is a normal finding. Again, now this time I'm going to place my hands at 5 different points, and then every time I place my hands, I want you to say the word 99.
Okay.
All right.
99, 99, 99, 99, 99.
Okay. So firmitis was noted, but it was decreasing as we moved inferiorly, which is a normal finding. I'm going to assess your anterior and posterior diameter. Good, which appears to be about 1 to 2, which is a normal ratio. Can I just raise your shirt up a little bit so I
Yes.
can visually inspect? Okay. So the skin color appears to be normal. The skin temperature is normal as well. I do not see any lesions or masses, which is good. Can I have you go ahead and turn back around so you're facing me? Good. So now we're going to move on from the lungs and focus in on your heart.
Okay.
So the first thing I'm going to do is I'm going to check your carotid arteries for any bruits. So can you kind of lean back for me? Good. I do not see any jugular vein distension when you do that, which is good. So I'm going to place my stethoscope in 3 different points on your carotid artery.
Okay.
And when I do that, I just need you to hold your breath for me, okay?
Okay.
All right, you ready?
Yeah.
Okay. Okay, go ahead and take a breath, and then we'll do the other side when you're ready. You ready?
Mm-hmm.
Okay. Okay. There were no bruits noted, which is a normal finding. Now I'm going to palpate your carotid artery if that's okay with
Yeah.
you. Okay. All right. Thing on the other side. Okay. So the carotid artery pulse could be felt bilaterally. The rate was regular. The rhythm was normal, and it could be graded as a 2+. It was nice and strong. Okay, so we're going to move on to listening to your heart sounds, if that's okay with you. So I'm going to place my stethoscope at 5 specific points. You can go ahead and just breathe normally, okay?
Okay.
heart sounds were heard clearly at all 5 points. S1 and S2 were clearly noted. There were no additional sounds present, as well as no murmurs, which is a good finding.
Okay.
At this point, if you're okay with it, I am going to have you lay back so I can assess your abdomen.
Okay.
Okay? Thank you. And do you mind if I pull your shirt up just a little bit?
No.
Okay, thank you. All right, so based on visual inspection, I can see that your color appears normal. I can see that your abdomen is normal in temperature. It does not appear to be distended at all, which is good. Do you have any concerns with your gastrointestinal system?
No.
No? And no changes in your appetite, in your bowel movements?
Nope.
No changes in voids?
Nope.
Okay. And can you tell me when your last bowel movement was?
This morning.
This morning? Okay, excellent. So the next thing I want to do is I want to listen to your bowel sounds. Okay. Bowel sounds were heard in all 4 quadrants, and they were active.
Okay.
I'm gonna go ahead and check for any bruise.
Okay.
All right. I did not hear any bruise, which again is a normal finding. And then if it's okay with you, I'm going to move on to percussion and then palpation.
Okay.
Okay, so I'm just gonna check for any fluid buildup. Okay, that was all normal. So for palpation, I'm gonna start with light palpation and then move into deep palpation if you can tolerate
Okay.
that. Okay. Any pain at any of those points?
No.
Okay, I'm gonna go ahead and move on to deep palpation then. Any pain at any of those spots?
Nope.
Okay, good. So at this point, I would assess your femoral artery, and then I will have you go ahead and sit back up for me. Excellent. You can face me again. All right. One more thing I need to check is your skin mobility and turgor. So essentially just how quickly your skin can move back to its original position. That's normal over there. Normal there as well. So skin mobility is within normal limits and there was no skin tenting noted. Do you have any concerns with your arms or legs that you want to bring to my attention? Any
No.
numbness, tingling, pain, decreased movement, range of motion?
No.
No? Okay, excellent. So the first thing that I want to do is just kind of visually inspect. So I can see that your arms appear to be symmetrical, and your posturing of them is normal. The color appears to be normal. I do not see any swelling present. You mind if I palpate for edema?
No.
Okay. Good. Same thing over here. Good. All right, so I do not feel or see any edema present, which is good. The next thing I want to do is just palpate your radial and brachial arteries. I'll take this hand from you. thing over here. Good. So the radial and brachial pulses were able to be palpated bilaterally. The rate was regular, the rhythm was normal, and they can be graded as a 2+. Okay, so I would like to also assess your capillary refill. Good, and then I'm going to do the same thing over here. Good, so the capillary refill was less than 2 seconds bilaterally, which is a normal finding. The next thing I want to do is, can you just turn your palms up for me? Good. I just want you to pull up against me. Good. And now flip your hands down, and now push down against me. Good. All right, and then can you shrug your shoulders for me? Good. Okay. So strength and range of motion appears to be within normal limits from what I can tell, but we'll assess that further later on. Let's move on and assess your legs, if that's okay. Good, so I'm gonna have you sit back so that your legs can be resting up here, if that's okay. Perfect. Are you comfortable like that?
Yeah.
Good. Okay, so based on visual inspection, I can see that the color of your legs is normal. Your legs appear to be symmetrical, and the hair is distributed evenly, which is good. I just want to palpate for 3 specific arteries in your legs and feet, if that's okay with you. Good. Okay, so I need your popliteal, your posterior tibial, and your dorsalis pedis. Good. We'll do the same thing over here. So bilaterally, your popliteal, your posterior tibial, and your dorsalis pedis pulses were all able to be palpated. The rate and rhythm were normal and regular, and they were graded as a 2+ bilaterally.
Okay.
Good. All right, so the next thing I want to do is check your strength. So can you push down against my hand? Good, and now pull up. Good, same thing over here. Good, and up. Good. Okay, and then let's check your capillary refill. Good. Good. And then I want to test your sensation. So can I see your hand for a moment?
Yep.
So I'm going to test your ability to decipher between sharp and dull sensations. So for reference, this will be sharp,
okay,
and this will be dull.
Okay.
Okay. I'm going to have you go ahead and close your eyes and just tell me what you feel.
Sure. Dull. Sure.
Okay, same thing over here.
Dull. Sure. Dull.
Okay, wonderful. Let's see. So this brings me to the part in our assessment where I need you to stand up if you're comfortable doing so.
Okay.
Okay, wonderful. Good. So I just want you to take a couple steps for me, kind of walk forward and back so I can assess your gait. Good. Good. Your gait appears to be normal. The next thing I want to do is the Romberg test. So I'm going to have you stand with your feet closer together. Perfect. And then I want you to close your eyes and just try to keep your balance. Okay, wonderful. You can go ahead and open your eyes. You have passed the Romberg test. So the last thing I want to do is just assess your range of motion, if that's all right with you. Okay, so let's come a little bit over here. Good, so I'm just gonna do some movements. I want you to follow those movements as best as you can.
Okay.
And if you feel any pain, let me know, okay?
Okay.
All right, so go ahead and raise your arms up. Good, bring them back down. Good, bring them out. Good, back down. Good, and then bring them out in front of you. Flip them up, flip them down, flip them back up. Bring your hands to your shoulders. Good, and back down. Good, and then bring your hands up like this. Bring your wrists down, back up, wave. Good, and then bring the back of your hands to your lower back. Then the front of your hands to the back of your head. Good. And then can you twist your spine? Good. Can you reach forward and try to touch your toes? Good. And then can you point your toe down? Point it up. And same thing with the other side. And up. Good. Bring your leg up. Good. How about the other leg? Good. And then can you turn and then bring your leg back? Good. How about the other leg? Good. Wonderful. And then we just need to assess your neck. So go ahead and bring your head down, back up, ear to your shoulder, ear to your other shoulder. Good. All right. Any pain or restrictions with any of those movements?
No.
Wonderful. Okay, so you can go ahead and sit back down. So that is the end of my assessment. Do you have any questions or concerns?
I don't believe so.
Okay, good. So I will tell you, based on my assessment, all of my findings were normal, which is good. The only thing that I really want to talk to you about today is just educating you on self-care when it comes to your skin. So, not to alarm you, but you do have, quite a few different moles on your skin, which is fine. That is totally normal. The only thing is that you need to keep a close eye on them to make sure that there's not any changes.
Okay.
Because sometimes those changes can indicate a melanoma, which
Okay.
is a very serious condition and something that needs to be addressed quickly. So there's an acronym that can help you to remember the things that you need to look out for that can indicate the presence of a melanoma.
Okay.
Have you ever heard of the ABCDE acronym?
Yes.
Yes, okay. Can you tell me what those stand for?
No.
Okay, so A is for asymmetry. So regular moles will just be nice and circular in appearance, whereas melanomas, they will be asymmetrical. So they'll kind of have like a random shape to them. B stands for borders. So melanomas will not have typical borders to them. They'll be kind of an irregular shape.
Okay.
C stands for color. Melanomas will typically be darker in color, usually like kind of a black or a purple. Those will definitely be ones that you want to get checked out. D stands for diameter. So anything greater than 6 millimeters in diameter is something that could be a high likelihood of a melanoma and something you'd want to get checked out.
Okay.
And then E stands for erythema, so just checking for redness around the area. And yeah, just make sure that you keep a close eye on all of your moles and that you're assessing those regularly for any changes. And then if you are noticing changes, you should go to get them checked out by a doctor.
Okay.
Great. Do you have any questions for me?
I don't think so.
No? Okay. Well, thank you so much for letting me do that assessment with you today. And I appreciate you coming in.
Thank you.
Yeah.